Welcome to British Biomedicine Institute. Today we will explore clinical epidemiology in radiodiagnosis. An important goal in radiology research is to estimate any causal effect of radiology interventions on patient outcome. Observational studies, including cohort and case control studies, are hypothesis testing, analytic studies that do not require manipulation of an exposure. A second goal of radiology research is to provide evidence to guide selection of optimal imaging strategies. Associations between clinical factors and diseases can form the basis of clinical prediction rules that guide development of imaging strategies. The most intuitively understood observational study is the cohort study, in which outcomes of subjects with and without a given exposure are compared. Cohort studies may also be retrospective. Exposed and unexposed subjects are identified retrospectively, after all outcomes of interest have occurred. Both exposure and outcome are then determined from medical records or some other data source. Risk ratios may be greater than 1, indicating positive association between outcome and exposure, or less than 1, indicating that a given exposure is associated with a decreased risk of the outcome. An advantage of a cohort study is that a single cohort may be used to study multiple outcomes. A disadvantage of a cohort study is that because subjects are selected on the basis of exposure, usually only a single exposure can be studied. In case control studies, subjects are selected on the basis of their outcomes. Cases are those with the outcome being studied, and controls are subjects selected, often at random, from the population from which the cases arose. Exposure is then assessed for both the cases and the controls. Case control studies may be used to study the impact of an imaging technique on patient outcome. Case control studies are a cost-efficient research design, particularly when the outcome under study is rare. Also, in a case control study, multiple exposures may be studied from the same data. As an example, CT scan, rather than radiography, may be the more cost-effective imaging strategy in trauma patients with a high probability of cervical spine fracture. A disadvantage of case control studies is that they yield the odds ratio rather than the risk ratio. The risk ratio from a cohort study has a more intuitive interpretation and is generally preferred because the risk ratio directly compares the proportion of subjects with the outcome in the exposed group with a proportion of subjects with the outcome in the unexposed group. In case control studies, the proportion of subjects with the outcome in the exposed and unexposed groups is generally not known, so the analysis is based on the odds of the outcome. Fortunately, when the study outcome is rare, in the population from which the cases and controls are drawn, the odds ratio will provide a good approximation of the risk ratio. In case control studies, bias can arise if the selection of cases and controls is affected by exposure status other than through the influence of the exposure on outcome. Similarly, selection bias can arise in cohort studies if the outcome affects the selection of the exposed or unexposed subjects. A useful approach to avoid selection bias is to define the target clinical population to which the results are expected to be applied. This population represents the ideal study population. Study subjects should be drawn from this target population when possible. Case control and cohort study designs are valuable alternatives to randomized clinical trials. These study designs are particularly useful in determining the influence of a radiology intervention on patient outcome and in determining clinical risk factors for disease in order to aid determination of optimal imaging strategies. However, radiologists should be aware of the uses, limitations, and techniques of observational study designs. Thank you for showing interest in British Biomedicine Institute. skilled non-degree program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe. British Biomedicine Institute channel. Good luck.